morning, everyone. We're actually on time, which is very exciting. It's so nice to be here with all of you. I said this is my first visit to this center, and it's beautiful. And Kim gave me a tour, so I got to see some of the programs that are going on here and the impressive artwork, and missed the line dancing though. The mayor and I said we got to get here earlier next time so we can do the line dancing. But it's a wonderful tribute to Bill Cashin and all of the great work that he did for people in Manchester for so long. So it's nice to be here and nice to join the mayor and Christina from AARP. So what I'm going to do is begin by asking folks to introduce themselves, and then I think we may ask all of you, if you don't mind, to introduce yourselves as well, so we know everybody who's here. I think we have enough time to do that, and then we'll start to talk a little bit about some of the legislation that I hope is going to benefit people throughout New Hampshire and the country. So, Christina, I'm going to ask you to go first.
Hi everyone, my name is Christina Fitzpatrick and I am the new director of AARP New Hampshire.
Hi everybody, I'm Anna Thomas. I'm the public health director with the City of Manchester Health Department.
I'm Kim Drohan. I'm the manager of the Cashin Senior Center.
Pat, yes, we'll flip that way.
You want me to?
Yes.
I'm Patrick McDermott here. I'm here as a constituent and I live here in Manchester.
And I'm Bev Cotton, another constituent, and I live in Ware, New Hampshire.
I'm Joyce Craig, a resident of Manchester, actually fourth generation here, and mayor of the City of Manchester.
Everybody knows Joyce.
John.
I'm John Jarvis. I'm on Center staff here in Manchester.
He actually runs our office, so if we need anything done, John's a good person to know. Yes. Can I ask you?
Sure. My name is Sharon Shaw. I'm a member here at the Senior Center, and I love the programs here, and people here are really great. It's a great center.
You can tell just walking around.
Yeah.
Yes.
I'm Karen Almer Dorsch. I'm from Sandwarton, New Hampshire, and I'm a member of AARP.
I'm Red Pettigrew. I'm a Vietnam veteran. And I'm a former Republican, but I lose very my ways.
Well, you won't get any disagreement from me.
And I think you do such a fabulous job that I can't see anybody elected.
Well, thank you very much. Fortunately, I'm not up this year, so, because, you know, one of those benefits of being in the Senate is that you have 6-year terms, so I got to do this in the last election. Yes.
I'm his wife, Marilyn Pettigrew. We've been married for 53 years.
Congratulations.
And veterans with PTSD, it took us so many years to learn about it that he drew something. And if you ever go to Price Right, which is on Lincoln Street, it's on the exit door. And it has a number for veterans to call if they have PTSD or if there's something wrong. So ignorance isn't bliss.
No, you're right. Unfortunately, we're still learning a lot. Yes.
Hi, Cheryl Sweet, staff of AARP.
Hannah Chisholm, staff of Mayor Craig.
Harry Kimball, constituent and also AARP member.
Phyllis Erickson from Manchester, AARP member.
Carolyn Moore from Manchester, and I'm on many organizations.
Lots of hats.
Tina Casson with Senator Shaheen staff. Elizabeth McKenna with Senator Shaheen staff. Cassia Burns with Senator Shaheen staff.
Jen Delaney, AARP team.
Iris Langley, member of the Senior Center.
Sam Paisley from Senator Shaheen staff.
Andrew Sylvia, Manchester Ink Link.
And our cameraman.
Brendan.
Manchester TV.
Well, yes, the man behind the camera. Well, thank you all very much for introducing yourselves and for joining us this morning. As I'm sure you've already figured out, Christina, you had a really strong organization here in New
Yes,
Hampshire
I
with
do.
lots of very active members. very important. I really wanted to talk a little this morning about the legislation that we just passed, which will address, we hope, the high cost of prescription drugs. The Inflation Reduction Act will allow the Centers for Medicare and Medicaid for the first time to negotiate the cost of prescription drugs. And I'm glad we've got a veteran here, because the comparison that I always make when people ask what difference will this make is if you look at the cost of prescription drugs through the VA, if you know anybody who gets prescription drugs through the VA, they are so much less expensive than the costs of prescription drugs have been through regular insurance or through Medicare. And so this is a real opportunity for us to reduce those costs for prescription drugs. There were a number of other provisions in the legislation that we passed that I think will also be helpful to healthcare. It extended subsidies for coverage under the Affordable Care Act for another 3 years. So for people who get their insurance through the private market, this is additional help that they will continue to have. The other thing it did was to cap out-of-pocket costs for insulin at $35 a month, which New Hampshire already has a cap on the cost of insulin, but for so many people across the country, that's really important. And as somebody who has a family member, my oldest granddaughter, some of you may know, has type 1 diabetes. And so I appreciate the struggles that families have with the high cost of insulin and dealing with diabetes, and obviously the cost of prescription drugs are challenging for everybody. The other thing that the legislation did is to cap the out-of-pocket costs for prescription drugs at $2,000 a year. Now, that sounds like a lot of money, and it is, but until this legislation, there was no cap on out-of-pocket costs for prescription drugs. So if your prescription drugs wound up costing you $5,000, $6,000, whatever it was, there was no cap on that. So this is good news, again, in terms of dealing with the high costs of prescription drugs. So,
Can I share something there?
yes.
I'm on Newpro for restless leg syndrome, $700. And I knew to talk to the doctor's office, and they did something. They sent an application in, and so, knock on wood, I'm getting it for free. So.
Yes, and there have been rebates in the number of prescription drugs, and that will also continue under this legislation. That's very helpful. So let me, because I really want to hear from all of you, and I know that Patrick and Bev are here to share the challenges that they've had. And so let me stop with that, ask the mayor if she would like to say a few words, and then we'll turn to Christina and Anna.
Sure. Well, thank you, Senator Shaheen, for being here and for getting us all together today. I really appreciate how you are so accessible and interested in what is happening at the local level, because it's very clear that you take that back to Washington and make a difference. So tremendously grateful for your work, and really looking forward to the conversation that we're having here today about the Inflation Reduction Act. You know, we do hear from our seniors, as Marilyn mentioned, you know, the high cost of prescription drugs, and the Pettigrews, you know, they're everywhere, and they know how to maneuver things. And so I'm not surprised, Marilyn, that you figured out a way to get that done in terms of, you know, cost. But there are so many other seniors that are not aware, so it's important to have these conversations that we're having today, so that people do understand what they need to do, because we do often hear about the high cost of prescription drugs and other things. We have been able to make some changes here in the city of Manchester to address concerns that the seniors have had in terms of costs, by reducing the cost of their taxes here in the city of Manchester. And Anna, I'm sure we'll talk about our community health workers who are going out into the community, speaking directly to seniors, and addressing quality of life issues and partnering with them to make their lives easier. I'd be remiss if I didn't thank Kim and her small but mighty team here at the Senior Center for all that they do. It's wonderful to hear firsthand from the members just how, you know, amazing it is, and the programming that you have really makes a difference in the lives of so many. So thank you for what you do. And then to AARP, we're really grateful for the partnership that the City of Manchester has had with you. Many of our outdoor spaces, the Dairyfield Park and the park along Arms Park, we've been able to partner and really make changes to have not only seniors but many residents here in the City of Manchester enjoy the quality of life and being outside and getting exercise. So I look forward to that continuing. So thank you for the opportunity today.
Thank you. Kim, my notes say that I should call on you next to see if you have any comments.
Well, thank you, Senator, for being here today, and, you know, I'm glad I had the opportunity to give you a tour and kind of see what the center here has to offer, because I think we do have a lot. We provide, activities, programs, clinics, but it's also education on diabetes or nutrition or various health topics, and things like prescriptions as well, Medicare, how to navigate it. And so, we try to give our seniors as much knowledge and help as much as we can. We also have resources that if they come to us, fuel assistance and food programs to help get them those resources. Our job here is to improve their quality of life so they don't need as many prescriptions, they don't need as many medications, they can live in their homes longer, and that's our goal here. And we do hear the stories about, I fell in the donut hole, and I can't believe the cost, like Marilyn's saying, it's hundreds of dollars, and nobody wants to choose between food or prescriptions. That's wrong. So, thank you for being here today, Senator and Manager as well.
Thank you. Christina, obviously the Inflation Reduction Act could not have gotten done without AARP's advocacy, so thank you very much.
This AARP's role in this is something I'm extremely proud of. It shows the power of AARP and all the different ways all the different strategies we have for influencing legislation and other things to make life better for people as they age. And that's our mission and our goal. And one of the reasons that I'm so glad to be here today is because that's what the Senior Center is all about as well, making connections. And it's just when you walk in the building here, you feel it. You feel this positive energy of people coming and being with others that they know. Sharon was saying she's here 4 days a week, and I just love that, and I'm glad to be here and be a part of that. So this is the passage of the Inflation Reduction Act is a monumental victory. It's been years and years in the making to address what is just patent unfairness that Medicare hasn't been able to negotiate prescription drug prices and keep costs down for seniors. It's just unconscionable. And so I'm just so glad that we're addressing that and that we're on our way to doing better for people. One of the things that AARP does is we make sure that we're listening to our members. And we did a poll and found that 85% of people 45 and older believe that affordable prescription drug coverage is either extremely important or very important. So 85%, this is just a fundamental issue for people. We also mobilize our members to get involved and let legislators know what's important to them. So they write letters to the editor, they contact their members of Congress. I know Senator Shaheen, you've heard from a lot of us, a lot of the AARP members. And also, one of the things I'm really proud of is that trying to get healthcare affordability, prescription drug affordability, that's the founding story of AARP. That's our founder is Ethel Percy Andrus. She has a wonderful story that I hope you will hear someday. One of our staff members just does a wonderful job of sharing that. And she founded AARP because she found that people who were retired didn't have affordable health insurance, didn't have affordable prescription drug coverage, she actually started a mail order pharmacy so that people could get access to drugs. And that was about using the power, the collective power of buying. So this is so fundamental to AARP, such an important victory. Really glad to have worked with you, Senator Shaheen, and really appreciate all the work that you did to make this legislation happen. And we will keep fighting to make sure that the legislation is implemented well, and we look forward to working with you, so thank you.
Thank you. And Anna, do you want to talk a little bit about the public health perspective here?
Yes, thank you, Senator, and thank you again for all that you do, and Mayor Craig, and certainly AARP. I'm a beneficiary of AARP, I have to admit. And I'm also, there's a side of this story that I think is really important. The fact that we have political leaders who avail themselves to all of us is really unique, and I feel very fortunate that at any given time, our political leaders are reaching out to us to hear from us, and so I just want to thank you for that service. I also want to thank this gentleman for his service, because I also served in the military for many, many years. Spent a lot of years at the VA Medical Center, and I know all too well, some of the very complex needs that we see from our veterans. It is challenging when we look at it community-wide as well. I've been with the city now for 28 years, and in Manchester terms, that's not a long time. So I feel like I'm just getting started. But I will tell you that aging and healthy aging is a priority, I think, for all of us, because when you think about the history of Manchester, for any of you who've been here for a long time, the city was never really designed around aging. It was designed around the mills, right? So we're thankful for not only the senior center, but AARP for really pushing us to think about how do we become an age-friendly community, and what does that look like? So we're all involved in those conversations and those plans. I think with people living longer now than ever before, most people over the age of 65, and I'm just using that as a random cutoff because aging is all relative, 85% of residents over the age of 65 have at least one chronic condition, and 60% have two or more. And these chronic conditions, as many of you know, or any of us know, that they span everything from heart disease, it could be cancers, it could be diabetes, there could be some mental health needs like Alzheimer's or dementia. There's other layers of that, lung diseases. These are really complex conditions to treat and very expensive. So this act is an enormous leap forward for all of us, because it's eliminating some of these barriers that unfortunately can curb someone's decision about how they access healthcare. And if they have to pick, a medication over whether or not I'm going to buy food today, it's very unfortunate and heart-wrenching to hear about that. I will tell you about our health department. We try to be a very proactive health department in the community, and as the mayor mentioned, through her leadership as well, we started a program where we have community health workers who are basically resident liaisons assigned to every ward of the city. And what our community health workers are doing is they're listening to constituent needs, being very present in these wards, being active in the community, and also doing a lot of home visits. We've partnered with Meals on Wheels, for example, to do a lot of the sort of the well check kind of visits with them. But another big piece of that is our partnership with the Manchester Police Department. Because unfortunately what we learned prior to enacting this initiative was there are a lot of folks who are aging at home and they're stuck and they don't know who to call for help, and often they're calling the police department, who has been enormously responsive. But we tailored this program to help curb some of those calls so the community health worker can go and do that visit when it may not need an actual police officer to respond. A lot of the calls are just quality of life calls, very basic need calls. So we're helping the police department to kind of triage, like who can go to this visit versus a police officer, and we're having great success early on. There's been a lot of folks we see who are living alone. Some of our older residents, about half of our residents age 65 and older, are living alone. We're watching people not socially connected, they're not connected to services, and that actually expedites the aging process. So we want to intervene in that because we want people to live as long and independent as they possibly can. We are very committed to trying to be where people are at when they need us, and certainly try to be as upstream as we can be in prevention. So we want you to do things like get vaccinated, because we know that that's a really important measure. I will tell you, in the COVID-19 era, unfortunately, about 17% of all of the infections in New Hampshire were among age 65 and older residents, but 90% of the deaths were among that population. So we know that not only are you at risk for those kinds of things and that vulnerability, but there's an even heightened awareness for all of you, because your immune system may not respond the same way as someone who is, 50 years younger than you. So this is why there's extra layers of protection that we want you to take. I just brought a case of 300 COVID-19 test kits for Kim to give out to all of you for free. When you need them at home, please use them. But also, be vigilant about your own health care and your wellness. And I just can't give you enough hats off to being at this facility, being active, being connected. This is what is going to continue to bring richness to your life, and I commend you because you're setting the example for the rest of us. So at any time that we can be of assistance, we're here. We're also going to be embarking on a program with the New Hampshire Army National Guard, and we'll be partnering with some of those active soldiers to go with some of our staff to do some home visits, and they're going to be health and safety home visits in partnership with the police department to some of our seniors who might need a visit. We also have some wellness kits that we're going to drop off. So we're trying to be out there. So know that we're there. Feel free to reach out to us at any time. And I look forward to hopefully seeing all of you in the future. So thank you.
Thank you very much. And the work that you all are doing is particularly important now. I don't know how many of you saw the data that came out this week about life expectancy in the United States that has gone down again several years in a row. So, and it's gone down more here than any other industrialized Western country. So we have lots of work to do. Excuse me, it's my allergies. Speaking of healthcare. But Pat, I know that you and Bev said that you would share some of the challenges that you face with prescription drugs.
Yes, we've got a couple of stories to tell. First of all, I would like to thank you again for your service, and also your caregiving. It's obviously very terrific, and that is so important. We really appreciate that. Thank you, Senator. Thank you, Mayor, for inviting me here. My name is Pat McDermott. I'm a Manchester resident for only 46 years. I grew up in Peterborough, so I am a New Hampshire native. And I think if I went through the lineage, my children are fourth generation Manchester people. I'm here today because this is such an important issue. It's such an important issue, the cost of drugs. And it impacts everybody. It impacts every American, no matter what age, no matter what income level. And no one knows when it's going to impact them. I have a friend, a good friend, who was diagnosed with cancer about 6 years ago. And he needed a stem cell transplant in order to basically save his life. And the preparation for the stem cell transplant required him to go through 6 rounds of chemotherapy, basically to kill off his immune system so that he could be treated. Each round of that chemotherapy was $80,000. So he was up to $500,000 in expenses before he even started treatment for his cancer. Fortunately, I talked to him recently, and 3 weeks from today, he's getting 7 inoculations, children's inoculations, that he's finally good enough to do that. And will, he's again in his 60s, but doing well. I have another close friend who has a chronic gastrointestinal issue, and it severely impacted the quality of his life, obviously in a negative way. And they tried the normal, so-called normal medications, and they really didn't have much of an impact on him. What is effective are infusions, and he goes every 60 days to Dartmouth Medical Center in Hanover for an infusion that costs $17,000 each time. In order to afford these treatments, he needs to continue to work full-time to pay his private insurance and also the co-pays. My friend is 75 years old, and he obviously would like to retire. I'm going to throw in another story, if it's okay. It doesn't impact exactly the cost of prescription drugs, but it does talk about the cost of health care. Our younger son, who's 28, has special needs, he's autistic, and he lives with us. He's a great young man. He lives with us. My wife and I are the primary caregivers. About a year ago, actually almost a year ago today, he had to have his wisdom teeth out. Now, they were impacted, they were all the terrible things. Because of his situation, he couldn't go to the normal, sit in a chair and have Novocaine kind of thing. He had to go to the hospital. It was single day, outpatient surgery, oral surgery, not counting the oral surgeon, anesthesiologist, and all the other stuff. The bill from the hospital was over $20,000. My son gets $1,018 a month from Social Security. So healthcare is a big issue. Really appreciate your efforts in getting this passed. We know the stories of a lot of people who are having trouble paying for their medications, having to choose between medication and other necessities. And because of this, and I know it's just the beginning, but because of this, our country and our state are healthier places now than they were before. Thank you very much.
Thank you. Beth?
Yes, again, thank you so much for being here, and for the opportunity to talk about this. People need to hear these stories. I'm just so very grateful for the passage of the Inflation Reduction Act, especially as it relates to the cost of prescription drugs. I've heard so many stories of folks struggling to find that balance between having to pay for their medications in the quantities ordered, or buy food, or pay for their utilities and things like that. And some folks can't make it. I am particularly familiar with one elderly woman. She was just one of those feisty, fiercely independent people who just wanted to do things herself and to be on her own and to be in her own home with her community and her friends. And unbeknownst to her family, she was rationing her blood pressure medication because she couldn't afford to pay for as much as she was supposed to take. So every third day, she would take her medicine. Well, ultimately, she suffered from a devastating stroke because her blood pressure was out of control. And after that, needed to live in a facility to get the kind of care that she needed. Her family would have been very, very happy to help her had they only known. But she didn't want to be a burden, and that's not an uncommon story with people as they age that need to hang on to that independence and that need to be self-sufficient. And this act is going to help pinch some of that cost downward so that they can have more success at achieving that. I also volunteer at a chemo outpatient infusion center. I was treated there several years ago, successfully, thank goodness. And I don't have millions of dollars to give them, but I have some time. So that's my donation. And I hear all of the time nurses talking to pharmacies on the phone. So I asked them about that. And what happens is this is an outpatient facility. Your person goes in, be there for a few hours, and while they're there, their family member, friend goes to the pharmacy to get their prescription fills and such. Well, what happens is they're calling the nurses in the facility saying, we don't have enough money to pay for what the doctor has ordered. is there something else that we can get instead? Well, obviously, the doctor wanted them to have that medication for a particular reason. And even some of those folks are in Medicare, but still, that doesn't take care of the out-of-pocket expense that people have to suffer. And these medicines could be for pain, they could be for nausea, they could be antibiotics for an infection, because people who are compromised are more prone to those things. It's not just the cost of chemo. However, there was one gentleman there that I got to meet, and he needed a monthly infusion, an outpatient infusion. That monthly infusion was $12,500. It was a remission extending medication. He ran out of Cobra because he was unable to work because he had every complication under the sun after his lung surgery. So while his daughter was trying to find some ACA marketplace coverage for him, he had to miss a couple months of his treatment, and unfortunately suffered a recurrence of his disease and passed away. Now, these people, when you think about it, their lives became a matter of dollars and cents. And geez, you know, there's just everything very, very wrong with that. So now there's some new hope, you know. Once these negotiations can begin, people will start seeing some cost benefits. The Part B cap is huge. I mean, this gentleman who was getting these infusions would have had a maximum of $2,000. Plus it's smooth, so he could have paid that over a period of time, not that day out of pocket bang, you know. So that is just amazing that that's finally here. And the inflation, the limit on the inflation adjustment, so that your drug price can't double and triple year over year like a lot of them do. So there are so many pieces of this legislation that are just phenomenally important, and some of them coming as soon as the new year with regard to like vaccines and that sort of thing, as well as others being phased in over a period of time. So this is just so critically important, and I just can't thank you enough for all of the work that you and your colleagues have done to finally bring this to fruition. So thank you so much.
Thank you both for sharing the experiences that you all have had. You're not standing there because I have to go, are you?
I was just gonna say. A couple more minutes.
Okay. Tina's the timekeeper.
Front desk, please.
But
Mark Ramsey, front
one of the
desk.
things that you both pointed out is that unfortunately, some of these policies are penny wise and pound foolish. I mean, the idea that we don't help somebody get their medication for blood pressure, and then she has a stroke and has to go into a nursing home, is a lot more expensive to keep her in a nursing home than it would be to make sure she has the medication. And that's what this legislation is about. It's about trying to address some of those really crazy things that we've got going on in our healthcare system that don't make any sense. I know one of the things that I'm still working on is something called the Insulin Act. And we were hoping to get that done before we got the Inflation Reduction Act done. And because of some other things that were going on in the Senate, it didn't happen. So we're still working on that because it would address not just that out-of-pocket cap for both Medicare and private insurance, but also for the underlying cost of insulin. We know 1 in 4 people ration their insulin. And at a time when it would make more sense to make sure that people can get insulin than have to go into a hospital because they have an episode from their diabetes. But as we have been working on this legislation, one of the things we heard from the Congressional Budget Office was that increasing the availability of insulin would make the costs to the government go up. And we said, we understand that, but it would also reduce all these other healthcare costs because of people not getting their insulin and having other health impacts. And they said, well, we can't account for those. All we can account for is the increased cost to the government of the insulin. I mean, those are crazy policies, and it reflects the kinds of things that you all pointed out that we have too often in our healthcare system, that we need things that make sense, and we ought to be basing our healthcare policies on things that are going to benefit people and take that into account, not just be restricted by these limited rules that the Congressional Budget Office or whoever, or whatever insurance company is using to make determinations about healthcare coverage. So it is a challenge that is ongoing, but the difference is really because of the advocacy of folks like all of you in this room, officials like Mayor Craig, health officials like Anna, who have really advocated to change the system, and that's what's going to continue to make a difference as we look at how do we continue to make changes. So thank you all very much. We need to implement this act now, make sure that it gets implemented in a way that's beneficial, and that we deal with the challenges that appear as the